Morning, all. Welcome to today's Cancer Healing Journey Talks. Myself, Annie Chose from Community Outreach Team of ZenOnco.io and Love Heals Cancer. Cancer Healing Journey Talks helps cancer survivors and caregivers to share their journey with vast number of survivors and caregivers who have traveled or been traveling through this journey. This can inspire and motivate them for their faster recovery as well. I would like to introduce today's speaker, Dr. Jamal Dixon. He is an internal medicine physician based in Atlanta. He is a graduate of Meharry Medical College and completed his medical residency at Grady Hospital via Morehouse School of Medicine. He is also a cancer survivor after being diagnosed with a rare stomach cancer during his final year of residency in the year 2017. During his experience as a patient, he witnessed the blind spots present in healthcare regarding the well-being and support of familial caregivers. He also witnessed how the mental and emotional traumas that patients experience from diagnosis and treatment were under-acknowledged within the healthcare space. So welcome to today's session, Jamal. Over to you.
All right, thank you. And I'm happy to be here. I'm happy to share my story and just some of the things that I've learned through the journey, because this is something that, impacts people all over the world. And this is something that a lot of people will have to deal with, whether they are the patient or whether they are the caregiver taking care of someone that they loved. So to start, I'll just talk about a little bit about my experience and the things I've learned. When I was completing my medical residency, I was in my final year, and I was diagnosed with cancer, right? And as a physician, it's a little difficult to come to terms with that, especially being young. I was 31 at the time, and really going through those steps and learning the patient side of it and learning how many gaps, how many issues and blind spots there are. And as I was going through, the multiple surgeries, I had 3 surgeries, I had complications, stayed in the hospital for 2 months straight, had 5 months of physical rehab once I left. There was a lot that I learned about the dynamic of a patient and the caregiver. And then I learned about how hard it really is for caregivers, because I'm seeing it every day with my parents. I was seeing what they were going through, and going to my follow-ups, I'm learning that, well, there are a lot of just gaps. There are a lot of times where the focus was on me as a patient, which makes sense, but no one was really talking about the mental and emotional struggles that you go through as a caregiver, especially when you're just suddenly thrust into that role of caring for someone, and you're seeing them go through sickness, you're seeing them go through medical procedures, you're seeing them deal with mental and emotional stress, and you don't really have an outlet, you don't have a space to really confide in, and you don't really know how to step into that role because no one ever prepares you for it. So as time went along, there were so many things I discovered about the interactions that the loved one has and that the caregiver has, and where the disconnect comes from. And it reminded me of so many patients I had seen as a physician, where I've seen families break apart, friends because as a caregiver, you're so passionate, you're so willing to sacrifice and neglect yourself in order to care for this person. And in that neglect, sometimes you run into burnout, you run into all these feelings and stress. And when there's no one to care for you, as you care for the person you love, that's where things can become strained. And as a patient, I learned that there are a lot of misunderstandings where if both sides were to actually understand each other, it would make the whole process smoother. And both sides are acting out of love, but it's just getting misinterpreted. For example, in my case, when I was first diagnosed, and that was September 3rd, the surgery was set for September 13th. And I remember I waited until the night before surgery to even tell my parents that, 1, I had cancer, and that 2, I was going through a surgery that was going to be massive. And at the time, I felt that I was 100% doing the right thing, and that I was sparing my parents from that pain. And at the time, no one could tell me that I was wrong in that. Now, looking back, of course, you would say, well, why wouldn't you tell your parents? Why wouldn't you tell, the people that are important to you? I don't understand that. But as a patient, a lot of times we look at it as, this is going to cause the people I love pain. How can I protect them from this pain? And sometimes with that thought, we do a lot of things that don't make sense and they're harmful, but they come from a good place. And it's all about understanding where that's coming from. I've seen patients where they would get diagnosed and they wouldn't tell their families at all until it was a really late stage. I've seen patients that were terminal and they waited until the last week. And when I would ask them, they would tell me, I love my family so much, I can't stand to live out the last months of my life seeing them go through pain. I would rather them be as happy as possible because I can't bear that guilt. And so a lot of times there's that misinformation, because I would see families after someone would pass suddenly and they would be left with so many questions like, why didn't they trust me? They didn't think that they could count on me. They didn't think I loved them. And it's all these questions that the remaining family has, and they don't understand that it's not that they didn't trust you. It's not that they didn't love you, but it's they wanted to protect you from pain. And that's the only way that they knew they could do it. That's the only way they felt they could protect you or prevent you from having that sorrow, from having that pain. And it sounds wrong and it sounds a little selfish, but just understanding that that's where patients come from on a mindset level and breaking that down to both sides coming together and work in unison. And that can clear up some of those remaining questions, because that's really where it comes from, where as a patient, if I know that my spouse or my parents, or if I'm, an elderly patient and my adult kids love me so much, sometimes you worry that they'll overwork themselves. And so as a patient, you think, sometimes I have to protect them from their own love, right? And then that manifests in different ways. So through my journey, I've learned all these kinds of things. And for me, it's really about bridging the gap between, what caregivers are thinking and experiencing and what patients are thinking and experiencing in real time, and showing them, hey, if they're doing this, this is where it's coming from. If they're saying this is what they mean, and this is how you work around that. This is how you guys come together so that cancer and illness doesn't have to break apart families. Because as a physician, I've seen that happen so much. You see families strained, you see marriages strained, you see friendships strained and broken. And I believe we can prevent that. But as a physician, we're taught to focus on the physical. And I can't blame the system for that, because that's important to worry about physical diagnosis, but we really miss the mark when it comes to emotional support, when it comes to mental support, when it comes to dealing with the traumas that come from treatment. There's a real traumatic experience coming from surgery. There's a traumatic experience you can have from chemotherapy. There's a traumatic experience just from hearing the diagnosis of cancer, whether it's breast cancer, colon cancer, whether it's a rare cancer. There's all these traumas and they don't go addressed on the regular in terms of medicine. So for me, having to go through that and learn it the hard way, I realized I had to learn it the hard way so I can teach others who are going to come behind me, because unfortunately, people are going to get old. Some people will get cancer, some people will get other diseases, COVID, pneumonia, all these things, and they're going to need someone that can guide them through that process. So that's really where I like to use my personal journey, all the surgeries, things that went wrong, procedures that went wrong. I've woken up during procedures while they were going on, all these things that have happened, so that I can teach others and really help the caregivers. We do a lot of work for patients, as we should. But the caregivers are always left behind. And that's where I like to come in, because someone has to support them while they're supporting the people they love. Someone has to step in and say, hey, here's where you can support them without overburdening yourself. This is where you can step in without feeling guilty that you're not doing enough. Because that guilt is really where a lot of caregivers suffer from. And honestly, we can say guilt is kind of a disease if we really want to break it down that way. So helping them work through the disease, helping them realize that they don't have to be Superman, they don't have to be Superwoman, and that they can allow the other members of the care team to help with caring for this person. You don't have to be the oncologist, you don't have to be the nurse, you don't have to be the wound care specialist, you don't have to be the physical therapist, you just have to be that person's spouse, that person's parent, that person's sibling. That's really what's needed. And then if you need the physical things of, hey, this is what you have to do with insurance, these are how you get the tools and the equipment to help them, I like to facilitate that as well. But what I've learned just from being a patient, from having to deal with cancer, from taking treatments, from dealing with insurance companies, from staying in the hospital, I've learned that there's so much care that we're missing for the family members of the patient. And we really need to start treating the family members of the patient as if they're the patient. Because once you leave the hospital, the story isn't over. There's still things that have to happen. There's still care that needs to be given. So that's basically a summation of the things I've learned and the things I experienced and how I want to make an impact within the healthcare space, because I can do everything I can as a physician, but I'm going to leave so many people out that deserve compassion, that deserve care, that deserve to be looked after. Because being a caregiver is hard work, especially if you're not trained in medicine. It's really hard to deal with someone you love suffering from an illness, and they need emotional and mental and physical support. So that's really where I'm coming from in this space.
Great, Jamal. So during your cancer time, so what treatment you underwent?
So the cancer I had is called a GI stromal tumor. So it's a cancer of the GI tract. So most of the time it originates in the stomach, sometimes the small intestine, rarely the large intestine. So the mainstay of treatment for GI stromal tumor, or a GIST, is surgical removal first. Then you have to take oral chemotherapy. So in this case, the IV chemo regimens, those don't work on this type of tumor. So I had to have a surgery first. The first surgery I had was 9 hours, and they removed 60% of my stomach because that's where it was growing from. And then they removed my transverse colon because it had grown so large that it had pushed my transverse colon down. So they had to remove that because they couldn't get clear margins, and then they combined the rest of it. So that was a third of my large colon, 60% of my stomach removed. After that was done, then I had to start the oral chemo regimen. So the first medication they gave me was Gleevec or imatinib. So with this medication, TKI inhibitor, unfortunately for this type of tumor, eventually this medication stops working, just through all the biochemical reactions or whatever. So it's really just a matter of time. For some people it's 2 years, some people it's 5 years, some people it's 15 years, but in a matter of time, it eventually stops working. So in my case, it was about 1.5 years when it stopped working. And then we had to switch to another medication that's also oral chemotherapy. So with the current regimen, I take it 4 weeks on and then 2 weeks off. And it's called Sutinib. So now the mainstay is surgery and then a TKI inhibitor, which is oral. And then depending on which oral therapy you take, is a certain schedule or cycle that you take it. So that's how you treat the cancer that I have. Oh, and then also I have to get CT scans every 3 months for surveillance. So that's also a part of it, just to make sure that everything is still being suppressed and that we don't have any new cancer growths.
Right. So, did you join any support group during your journey?
So for me, no. And I didn't really know where to look for a support group. And in my case, I was fighting so hard just to get back to the normalcy of life, that I really didn't want to hear the stories just for me. And I think that's something that a lot of patients struggle with is, where do I go? How can I find these groups? And do I even want to hear it? Do I even want to deal with that? Or do I just want to shelter myself in? So I couldn't find those groups. And I recognized how important it was, looking back at it, to have that space. That's why, programs and websites and companies like you guys are so important, because it's different when you have a group of people that have been through it to support you. And I know that would have made my entire journey easier, to be around people that have gone through it. And a lot of times as patients, we just don't know how to ask. And my family didn't know how to ask. They didn't know where to go for support. And so it was really just us trying to figure it out. And that's why, after looking at you guys and your site and the things you guys are doing in the space, it's so powerful, because that support is needed. And we overlook the intangible support for the physical. And that's really where we need to do a lot more. And I'm happy that you guys are doing the work that you're doing.
It's wonderful. So there are various types of stigmas all around the world regarding different types of cancers. So what do you think about all of these stigmas, and how much do you think is the importance of awareness to the public?
So in terms of, it's really a tough spot, especially as someone who's gone through it myself. Unfortunately, there's still a lot of work to be done when it comes to these stigmas. There's a lot of work to be done in terms of surveillance, in terms of actively testing for it, in terms of overcoming the fear of testing. Especially in America, it's really hard to get people to really advocate and take care of themselves, because just that I might find something, or go through a colonoscopy if I want to go through the prep. I don't know if I want to go through a mammogram. I don't know if I want to go through these certain things that are invasive. I don't know if I want to have a pap smear. There's a lot of things that we have to deconstruct and break down and make things that aren't taboo anymore. And I think that's where the issue is that a lot of people don't like the evasiveness of the testing or the frequency. I think a lot of it comes from just the fear of the medicine system at large, at least in America, just because there's such a history of malpractice. There's such a history of things going wrong. There's such a history of companies making profit off of human beings, that people just kind of push back against that testing. They kind of push back against, well, can I really trust the healthcare system? And I think because there's a lack of trust, that bleeds over into the stigmas, into where, if you got cancer, that's something you could have prevented. A lot of people say that, and unfortunately, that's not true. We can do everything. We can do health-wise. We can do all the healthy diets, vegan, vegetarian, keto. We can do everything possible, and you can still get cancer, unfortunately. There's so many pollutants in our environment. There's so many pollutants in our food. No matter where you go, there is that risk. There's so many cells that divide inside of you on a daily basis. It can happen. So a lot of it is deconstructing that, and then showing that even though you have cancer, you can still overcome it. You can still live a full life. You can still be powerful. You can still be strong. You can still make it through. And it doesn't have to mean the end of your life. It doesn't have to mean that your life is going to be ruined from here on out, or that you'll never experience happiness again. And it's easy to fall into that space because cancer is scary. And I think we just have to admit that it's so scary that you can watch your body betray itself, so to speak. And that fear of the unknown, of what's going to happen after this chemo? Is my hair going to grow back? Am I going to be able to be strong again? Am I going to be nauseated? Am I going to be able to eat again? How am I going to look after, I get, surgery to remove this tumor, right? How am I going to look if I have to have surgery on my breast to remove this tumor? What's that going to be like? There's a lot of stigma that happens. And so I feel like we need these kinds of platforms to help people through that process. It's really just about raising awareness, having people that have gone through it speak about it. And through that, we can empower other people when they come across a diagnosis or a family member that has it. But it really starts with us in the community, whether you're a patient, whether you're a caregiver, whether you're a medical provider, to just spread that awareness that, hey, this has happened to you, but it doesn't have to end you. It doesn't have to define you negatively, and that you can still be empowered in spite of all that has happened.
So one last question, Dr. Jamal. So that will be, if you have to sum up your journey in one sentence, what would that be?
Summing up my journey in a sentence, I would say this journey is the sole reason that I found my purpose for being alive. To be honest with you, before I was diagnosed, even though I was already a physician, even though I was already in residency and about to finish, it wasn't my purpose in life. It wasn't the reason why I was born. I'm good at it. I enjoy it. I love the patients. I love the interactions. I love being able to help people, cure people, and restore people. But it wasn't my direct purpose. So this entire journey that I've gone through has led me to my purpose for being alive. And it took me 33 years to get there. So now I know why I was placed here on this planet and the people that I need to serve. And these are often people that are looked over. These are people that are forgotten. These are people whose voices aren't heard. These are people whose concerns aren't mentioned, aren't cared about, and they feel like they're left out when it comes to the healthcare system. And those are the people that I know I have to serve. And I wouldn't have ever stumbled upon that had this journey not happened. So in a sentence, this journey led me to my purpose for being alive.
It was wonderful. So thank you so much, Dr. Jamal, for the wonderful session. So I'm sure that this session will really motivate you. So who is currently going through the journey or who has traveled through the journey. Thank you so much once again.
Thank you.